Today, I want to discuss the importance of cavities and treatment plans with you. Cavities are decaying portions of teeth due to acids produced by bacteria. Many people lose their teeth because of cavities. Today, I will be talking about the tooth structure, cavity formation, and treatment options. I have done a lot of research into this topic and have shadowed a dentist. Firstly, we will discuss the tooth anatomy. Teeth are comprised of three main layers: the outer enamel layer, the middle dentin layer, and the inner pulp layer. Enamel is the outermost layer on the teeth, and according to Colgate, enamel is the hardest part of the tooth and is comprised of hydroxyapatite and can be damaged by decay. Dentin is the layer found under the enamel and is composed of calcium and phosphate. You can have some sensitivity in the dentin layer due to tubules and nerves from the pulp. The pulp is the centermost layer of the tooth where all the nerve tissues and blood vessels are located. Now we know this tooth structure, we can discuss cavity formation, also known as dental caries. Dental caries usually start off as a small patch, usually not visible to the eye. The decay can spread downwards into the middle dentin layer. By spreading downwards, the weakened enamel on the surface collapses, which thus forms the cavity. Dental caries are created by acids on the enamel. Acids are created when sugar from food reacts with bacteria, according to the Dental Health Foundation of Ireland. Acids created by bacteria leaches the calcium and phosphate from the enamel via demineralization. Saliva, however, is very helpful in mitigating the harmful effects of the acid. Saliva dilutes and neutralizes the acid, and saliva also contains many minerals which contribute to the process of remineralization, which is the restoration of the enamel destroyed by acids. Demineralization and remineralization occur multiple times throughout the day. According to the Dental Health Foundation of Ireland, when demineralization occurs more than remineralization for a prolonged period of time, caries progress. Cavities are, cavities are detected by x-rays, probing, and sensitivity to hot, cold, or sweet foods. Cavities are found Cavities that are found early can be found on just the surface of the enamel, and other cavities that have not been taken care of for years can be burrowed all the way to the pulp, requiring more extreme ways to save the tooth. Lastly, we will discuss treatment options for cavities. Now that we have discussed about the formation of cavities, one of the most effective methods at reducing incidences of cavities is by fluoride treatment by use of tap water or fluoride toothpaste. Fluoride, when mixed with your saliva, which also fights acids from bacteria via remineralization, allows for fluoride to enter your enamel. Once in your enamel, fluoride binds with phosphate and calcium to strengthen your teeth by forming the fluoroapatite structure, which is a form of the hydroxyapatite structure. The fluoroapatite structure is much stronger and resistant to decay, according to the ADA. Adding fluoride to tap water was one of the most effective public health initiatives and drastically decreased the number of cavities across the population, according to the ADA. More invasive methods of cavity removal can be done by dentists in clinical settings. Dentists perform procedures such as fillings, crowns, root canals, and tooth extractions to remove cavities. When cavities can no longer be treated with fluoride treatments, fillings are performed. Fillings are performed when the cavity area is drilled and removed from the tooth and the filling is placed in place of the extracted area of the tooth. Filling materials are composite renins, porcelain, or dental amalgams, according to the Mayo Clinic. When there is significant decay on or in the tooth, the infected cavity area is removed and a crown is made to be placed on top of the remaining portion of the tooth. A crown has the size and dimensions of a regular tooth when the cavity has reached the pulp of the tooth. Either a root canal or an extraction can be done. In a root canal, the infective pulp is removed and replaced with a filling. The tooth is dead but is not extracted. If you cannot afford to do a root canal, as they are expensive, many people opt to have the tooth removed. So today I have talked to you about the tooth structure, cavity formation, and treatment options. It is important to be informed of the structure of teeth and how cavities are formed and what your options are if you develop them to prevent such incidences from occurring or knowing what to do if they do occur. Thank you.